Hello and welcome to the Concentra webinar, Athletic Trainers and Preventing Work Injury. Today's webinar will be presented by Chris Studebaker and Megan Abelny. Chris has worked as a physical therapist and ergonomics consultant in heavy industry for more than 15 years. Board certified in orthopedics, Chris also has certifications in manual therapy and health coaching. Megan is a certified athletic trainer who has worked in collegiate, high school, and industrial settings and has served as a physician extender in orthopedics. At the conclusion of the presentation, we will have a 10 to 15 minute Q&A session. You can submit your questions throughout the presentation to be answered during the Q&A. We will answer as many questions as possible within the time allowed. A recording of the webinar will be emailed to you after the presentation, so you can view it again at your convenience. Chris, Megan, we're ready to begin.
Sounds good. Can you hear me okay?
Yes, I can hear you, Chris.
Awesome. Well, thanks for coming out to the webinar today, guys. This is a topic that's near and dear to our hearts. We're going to be speaking about common issues that employers face in regards to musculoskeletal disorders. And then we'll be discussing how athletic trainers can help with some of those issues, also describing what their background, their capabilities are, how they're different maybe from some other industrial healthcare professionals you're accustomed to, and then ultimately discussing some of our case studies and our successes using this model in a variety of different industries. And then finally, we'll have a Q&A if you have any questions afterwards. Go ahead. All right, go ahead, one more. So employers overwhelmingly come to Concentra for injury care around musculoskeletal disorders. The main thing that we see from employers is that the strained backs, the shoulder surgery, the torn knee, those are the things that are really the big cost drivers for most of our clients. Some of them have contact dermatitis or something gets in your eye, but by and large, when people get hurt on the job, it tends to be a musculoskeletal case. As you guys know, that can cost money right out of your pocket if you're self-insured. It can drive up OSHA recordability. It can impact your lost time metrics. So it can hit you in the wallet, and it can indirectly hit you in your insurance as well. Go ahead. So, what we see is the old way of handling musculoskeletal cases in the work environment was, well, we're here at Acme Packaging. We got a guy who slipped and sprained his ankle. We got to send him into some outpatient OC health center, and we hope it doesn't get expensive. We hope it doesn't turn into litigation. We hope it doesn't become a recordable injury. Well, that model, kind of the old way, was fine for treating one isolated injury and getting that person back on the job, but it really didn't always address some of the underlying issues that lead to people getting re-injured. So businesses kind of, especially in the 90s, but through on till today, really started to look at a different model. They didn't like that reactive model where you just wait till somebody gets hurt and then roll the dice with controlling the case and with your OSHA metrics. So, we see all of these employers that have a lot of issues with lost time cases, tons and tons of recordable injuries nationwide. And a lot of employers have just decided that this is not acceptable, that they need to find an alternate way of managing their workers' comp musculoskeletal spend. Go ahead. And so around the 90s, you started to see the use of on-site athletic trainers in particular, which really began more in manufacturing, but has subsequently spread to warehousing and distribution, to municipalities, even into healthcare itself for dealing with people who get injured in the healthcare world. The athletic trainer has been brought into the work environment in a lot of forward-thinking workplaces to help to mitigate against these musculoskeletal injuries. Sorry.
All right. So what is an athletic trainer? A lot of people have that question. I know I still get asked every day while I'm in the clinic. A certified athletic trainer is a healthcare professional who specializes in prevention and care of activity-related injuries. We are nationally certified and licensed providers. Our training and experience allows us to look at industrial workers as industrial athletes. As an athletic trainer, we do a lot more than just preventing injury. We assess those injuries, we treat those injuries through rehabilitation, and we have the opportunity to reduce the severity of injuries. As trained professionals on the first line of defense, we get a unique opportunity to impact the overall health and safety of industrial athletes on a day-to-day basis. Next slide, please. So a lot of people assume athletic trainers have minimal training. However, certified athletic trainers are required to have either a bachelor's or a master's degree. Our education as athletic trainers is to learn comprehensive patient care in 5 domains of clinical practice, which includes prevention of athletic injuries, clinical evaluation and diagnosis, immediate and emergency care, treatment and rehabilitation, as well as organization and professional health and well-being. The National Athletic Trainers Association, which is in the United States, also sets the same standards internationally and has worked with other organizations globally to set a consistent standard of care. Since we are nationally certified and licensed in each state, there is sometimes some state regulations that differ, but your occupational health provider would be able to advise you on those different jurisdictional rules governing athletic trainers. Next slide. Industrial athletes, or as we like to call them, are athletes here on site. They're very similar to your typical sports athlete. Both populations are at a high risk of musculoskeletal injuries, both being acute and chronic issues. Our industrial workforce is working in physically demanding jobs, and many of these employees want to continue working even when they're injured. As an athletic trainer on site, we get to assist those employees with staying in the game, whether that is through rehab, modifying their work activities, and doing day-to-day check-ins on their care. Employees, just like most athletes, have their identities tied into their jobs, and we're here to assist those employees not only in the physical health, but emotional and mental aspects of injuries as well. Next slide. As an athletic trainer, we have the knowledge and ability to design and implement preventative programs, which include stretching and strengthening. Those can be done either before work, during work, or after work, depending on people's work schedules. We develop rehabilitation plans, which are unique to each person. We can help assist with ergonomic assessments, and we assist with the overall management of work comp injuries and illnesses. Since we're on the scene from day to day, we're here throughout the entire treatment program, which allows for continuous care and helps with building rapport with those employees. By building that rapport through day-to-day interactions, our communication with each employee improves. We get to know them a little bit better. They learn to trust us, which typically leads to seeing an increase in those early reporting numbers, which in turn will then allow us to begin to treat them sooner and decrease the chance of an injury becoming more severe and potentially recordable. Next slide, please. As an athletic trainer, I often get mistaken for a personal trainer. The main difference between an athletic trainer and a personal trainer is the level of education and training required for our profession. Personal trainers are not nationally board certified, nor are they trained in musculoskeletal disorders. Athletic trainers, on the other hand, we are educated experts in those musculoskeletal disorders, which includes everything from a minor ankle sprain up to something that needs to be surgically treated. And then we assist with that aftercare after surgery. Athletic trainers require an advanced degree, which allows us, again, to assess and treat, as well as prevent those injuries from occurring. The training and education an athletic trainer has far exceeds that of a personal trainer. And I believe this difference in education alone is what allows us to be a great asset for all industrial employees and workplaces.
So, unfortunately, in our line of business, let's face it, most people don't really know what an athletic trainer does. Maybe they've seen them on the sidelines of their favorite sporting event, but it doesn't usually occur to most employers that this highly trained resource could work on site, in their work environment. They oftentimes confuse athletic trainers for personal trainers, as Meg mentioned, or sometimes we'll think that an exercise physiologist could do the same job, but an exercise physiologist does not have really much training in the musculoskeletal system from an injury management standpoint. Ex-phys folks are great for cardiac rehab. They're great for measuring performance, but they're not trained to manage injuries. Next slide. But probably the biggest difference that we tend to point out to employers is, a lot of employers are very familiar with the concept of that on-site OC health nurse. Let's say maybe they've got 400, 500, 600 workers, and they'll hire a nurse, to kind of be there in case there's, boo-boos and things like that. The problem with that is, for a lot of employers, that nurses don't have much training in the musculoskeletal system. So when you have an employer who's seeing 70, 80, 90% of their workers' comp cases be musculoskeletal in nature, a lot of them are turning more and more to the athletic trainer role. And we'll talk about what the athletic trainers can do in the work environment here in a second. So, depending on the type of work environment you have, a lot of times we recommend to the client, hey, take a look at the athletic trainer role. If you have a ton of audiometry and a bunch of non-musculoskeletal issues, yeah, stick with the nurse. But for clients that have really a need for the musculoskeletal system or job analysis or just minor scrapes and bruises, the athletic trainer role can make a lot of sense. So the great thing about these guys, and I'm a physical therapist by background, so I'm not necessarily a homer on this, but I've seen them over the years just really thrive in this environment by really just changing the entire dynamic of the OC health system. They switch the emphasis away from being that reactive model we spoke of earlier and towards one of prevention. You hear prevention thrown around all the time, but a lot of people don't really mean it. But the athletic trainer role in the on-site setting really is really the tip of the spear of prevention, because they help to get in and work with workers, immediately, same day, same hour sometimes. Joe pulled his shoulder. Can you take a look at him? Hey, I think I tweaked my back a little. Can you take a look at it? Because they're right there, they're immersed in the work environment, and they can really help control not only workers' comp costs, but also your OSHA metrics. When we bring an athletic trainer in, we typically see a reduction in OSHA recordability anywhere from 50 to 70% in musculoskeletal cases, and usually a reduction in lost time by a significant margin, which we'll talk about in some of our case studies here in a minute. But maybe more fundamentally, the athletic trainer becomes an extension of your OC health program that's really immersed in the work environment. We always tell these guys when we hire them, hey, if you want to sit in a clinic all day behind a desk and wait for people to come to you, this is not the job for you. We expect you to mix your time between being in the clinic and being out, on the line, in the warehouse, where workers can see you, where you learn about their jobs, where you analyze their jobs and really become, on the first name basis with these workers. Next slide, and I'll turn it over to Megan. Oh, sorry, this is my section. So, sorry about that. So, some examples of what we've done in some other locations. We've had our trainers, work in a wide array of environments and doing a lot of different things. Some of them just stick with patient care. They only treat injuries. Others are really a Swiss Army knife of Occ Health services, doing drug screens, doing breath and alcohol, doing ergonomics, teaching pre-shift stretching programs, working with your payer to make sure they have functional job analyses to know what the job requires. Even acting as health coaches to be the real boots on the ground resource for an employer's wellness program. Teaching classes, doing one-on-one health consultation, all kinds of different things. Okay, so one example. Go ahead, next slide. One example where this was really successful, we had a semiconductor manufacturer that, that sounds high tech and probably not much material handling, but it's actually a pretty physical place because it's a factory that makes machines for semiconductors. A lot of lifting, pushing, pulling, a lot of awkward postures, and we brought in an athletic trainer and cut their workers' comp spend, more than in half when you adjusted, for the head count that they had there. We dropped their OSHA recordability. I don't think they had more than 2 lost time cases that year, if I recall, and they continue to grow this program, not just treating injuries, not just using first aid to try to avoid OSHA recordability, but also, for design, where he works with the engineering department to try to quantify safe amounts of lifting, safe amounts of repetition, helps to identify solutions to their awkward posture issues that they have. So it's been a really big success at that particular location. Next slide. We had another plant that made medical devices, ultrasound machines, all kinds of stuff like that. We brought in an athletic trainer there, and he really knocked the cover off the ball. They went from 28 lost time days to 0. I think maybe they had 1 OSHA recordable that year, his first year after having, 7, 8, 9 the year before. But he really took the reins on developing their ergonomic program to the point where they ended up hiring him from us to run their corporate level ergonomics program for their engineering and HSC department. That one, he worked with an on-site nurse. The one before is the only practitioner there, is the only healthcare resource. Some of these guys work in a team in a bigger clinic, along with a nurse practitioner or front office staff. Others are solo in the work environment. Next slide. We had one at a distribution center, so not just limited to manufacturing, but warehousing and distribution as well, where we saw a great reduction in their DART rate, saw a drop in their OSHA recordability, and also really helped to control their workers' comp costs as well. Again, we're most successful when we can use the athletic trainer to do a lot of different things. These guys tend to have one foot in the Occ Health world and the other foot in the technical safety world, where they work, hand in hand with your EHS department. They also can partner with HR when it comes to issues of return to work or accommodation. They can work with your engineers to help bring that biomechanical model to your ergonomics program. They help to be the glue that holds together the communication between all the stakeholders on the employer side, with the payer, and even the community Occ Health providers when they have to be referred out. Next slide. One more for me. So in a nutshell, this is a different role. It's a different take on Occ Health. When we explain the potential of the athletic trainer to larger employers with a lot of musculoskeletal issues, man, it's like a light goes off. They're like, oh, we could do that? We bring these guys in. They are very successful using first aid level interventions Sometimes they have to be escalated to recordable level care, but 60–70% of the time we don't need it. We get them better using first aid level interventions. You've got a lot to work with. You've got massage, you've got flexible taping, ice, heat, topical analgesics, you got over-the-counter NSAIDs, you got soft splints, non-hinged braces. You got a lot you can work with if you can get a hold of the workers early, which is what these guys are usually able to do. Again, it really switches that emphasis away from being reactive in the old model and expensive to being proactive, preventive, and everybody wins. The employer wins, the employee wins. They get care a lot of times much quicker. Payer wins, HR wins, everybody wins with this model. Because it truly does reestablish a different dynamic in the Occ Health system. So, obviously, we're not the only people who do this, but if you ever need this kind of program, if you want more information, want to hear more about it, how it could work for you, we're certainly here for you. Happy to talk through this in a more detailed one-on-one manner, but I'm going to go ahead and open it up to you guys for questions and answers. Back to you, Anna.